Look, I mean, the big ticket items that most people are concerned about are their chest and their tummy. And usually the procedures that require the most downtime is going to be the tummy, because that's the bit that is often the tightest. That's the bit that requires the most amount of care afterwards to get things to heal. And that's the thing that slows people down the most. Because it's so tight, people feel the procedure more so. And so usually I say to patients that, you know, for the first 6 weeks you're going to visibly to other people look tight. So you're partially flexed at the hips, you're hunched over a little bit. But it takes people a good 3 months before that really properly settles down and they're back to feeling like they can go to the gym and do all sorts of normal things. So usually things are geared around the tummy in terms of downtime. The other procedures, I mean, they all involve long incisions, which means long scars. And we try and hide those scars as best we can. The procedures that also can be slow to heal, the other one that springs to mind is going to be with the thigh, the upper thigh reductions, because those scars are usually in the groin crease, and just because of that, they're often slow to heal. And so those are not like scars on the face that heal beautifully and quickly. These ones on the groin, they take time. And so that slows people down the most. Usually my approach to these procedures, if everything's on the table, so to speak, my approach usually is to try and deal with the tummy and the breasts first. Occasionally, if the breasts aren't an issue, then doing a circumferential body lift. So that means doing the tummy as well as the back in the one procedure is a good way to try and set the foundation, so to speak, because it helps to reduce obviously the amount of skin and fat that's around that mid part of the body, but it also helps with the buttocks and the thighs. So it means that you can sort of set the foundations for the buttocks and thighs, and it probably means that I end up having to do less thigh work and buttock work if the tummy and the buttock lift have done their job or done a good part of the job. So I like to do that first as a way of setting the foundations, but it's an individualised process because it depends on what sort of work people do. Is it a physical job? Is it a sedentary job? Do they have control over their hours or not? And all those sorts of things. So it's highly individualised.